Hello, everyone. So, my name is Daniela, and today I'm going to present primary amoebic meningoencephalitis, which is caused by Naegleria fowleri. And just before I start my presentation, I want to let you guys know that it does sound like it's about to storm outside. So, if you guys do hear any thunder, um, that's what's going on outside. I also have brothers who are currently playing video games in the other room with their friends, so if you hear any yelling or anything like that, that's them. Just so you don't think that there's something crazy going on in the background. Everything is okay. All right, so let's get started. What is primary amoebic meningoencephalitis? So it is abbreviated PAM. So if you hear me say PAM, that's what I'm talking about. But it's basically a rare and fatal disease that occurs in the central nervous system. And like I said before, it's caused by Naegleria fowleri. And on this image right here, you can see Naegleria fowleri in a phase contrast microscopy. Just look like tiny little worms. And in this image right here, you can see it where it has infected a human brain. Looks kind of gross. All right, so this is just a video that I included of them moving. Oh, no, sorry. Just so you can see them in the contrast microscopy. And so Naegleria fowleri is also known as a brain-eating amoeba. So it is a species of the genus Naegleria belonging to the phylum Pericozoa, which is technically not classified as a true amoeba, but a shape-shifting ameboflagellate. It is a free-living bacteria-eating microorganism that can be pathogenic. So it's basically what causes PAM. So when was PAM discovered? PAM was first recognized in South Australia in 1965 by two physicians, M. Fowler and R. F. Carter. In 1966, 4 cases were reported in the U.S. It is considered at the time a serious health hazard, and it was a serious health hazard until the early 1970s. The map here that I have included shows the Great Artesian Basin in Queensland, Australia. So basically, water was pumped from the basin, and it was pumped across miles and miles of rural land to all these homes that were in this area. And so as that water was pumped, during like these long distances, it was creating the perfect environment for the amoeba to grow and to live. And it resulted in 13 cases, which occurred between 1955 and 1972 in South Australia. Has there been any change in the way that the disease has been defined? Since 1965, more than 144 cases have been confirmed in different countries. By 1968, the causative organism, previously thought to be the species of Acanthamoeba and Harithamella, was identified as Naegleria. M. Fowler and R. F. Carter's work on amoeba flagellates has provided an example on how protozoan can effectively live both freely in the environment and in a human host. A retrospective study determined the first documented case of PAM possibly occurred in Britain in 1909. So I just want to point out that it's important what M. Fowler and R. F. Carter did, because they basically showed that these protozoa can not only just live in the environment, but can also be able to live in a human. And I think that's really important when it comes to making sure that our environment is clean, like how we discussed in our modules about keeping like streets clean and making sure that we're drinking clean water, because I'm sure, back then, like, people didn't really care about how clean their water was that they were drinking. Like they just kind of drank whatever was, found. And I mean, back then they didn't really have ways of cleaning water, or they didn't really have ways of, cleaning the water that they, showered in, or the water that they cleaned their clothes in. And I think this is really important in shaping how we sanitize what we eat and what we drink and what we ultimately like clean our clothes and bathe in. Uh-oh. Oh no, my computer froze. Okay, there we go. All right, so how is PAM understood clinically? So N. fowleri invades the central nervous system via the nose, specifically through the olfactory mucosa of the nasal tissues. This usually occurs as a result of the introduction of water that has been contaminated with N. fowleri into the nose during activities such as swimming, bathing, or nasal irrigation. So that is basically how people got infected with Naegleria fowleri. It's the primary reason that people get infected is that people are swimming in a natural water source that contains the amoeba. So then from there, the amoeba follows the olfactory nerve fibers through the cribriform plate of the ethmoid bone into the skull, and then there it migrates to the olfactory bulbs and then to other regions of the brain where it feeds on the nerve tissue, and then it begins to consume the nerve and brain tissue. So, like I said before, Naegleria fowleri likes to propagate in warm, stagnant bodies of fresh water, and this typically happens during the summer months, which is when people like to go swim, and people like to go to lakes and stuff like that, and it's usually when even though I did say that the cases are rare, it's usually when the cases do happen during summer warm months. And here I just included a nice image from the CDC that just kind of shows not only the life cycle of Naegleria fowleri, but it also shows how it goes into the body. So it shows Naegleria fowleri as a cyst. And so here, I did mention that it likes to propagate in water, but it also can be found in soil, but we usually become infected when it's in water because, we're not usually, digging our noses into soil or anything like that. It's usually because people are diving into water and you accidentally inhale some water, you swallow some water, and then here it just shows them becoming into their trophozoic states, and then that's what you saw in the video that I showed you. And so it shows like a little hazard sign because this is when they are most like lethal, I guess. And yeah, so then water-related activities such as swimming, underwater diving, and other water sports can result in water entering the nose, and then here you see how it migrates. So yeah, not good for you. So I included this because I thought it was interesting to see how it actually physically affects the body. So I included a case study of a 14-year-old girl with a history of seizures and loss of consciousness for 3 months. So these first 3 images just show multiple discrete focal hyperintensive lesions at the corticomedullary junctions, the basal ganglia, and the midbrain. So those are shown here by these arrows. So as you can see, the Naegleria fowleri have already begun to start eating at her brain. And then image D shows the same thing, but just kind of at a side angle. And then from image E, you can see multiple bilateral necrotic lesions largely confined to the gray-white junctions. And so here, it's shown right here in these like areas right here. And then the last one is just showing the trophozoites surrounded by inflammatory cells against the background of necrosis. So you can see them right here, so they're pretty big. All right, so what are the symptoms of PAM? So symptoms can start 1 to 9 days after infection. So like I said, after swimming, after drinking water from a lake. Also, I forgot to mention this, after if you so happen to do like one of those nasal, what are they called? Like using one of those like neti pots, like the nasal irrigation things, that also can cause it, especially in underdeveloped countries. That has been a cause of it. But like symptoms can start 1 to 9 days after infection, 5 being the median, and people die 1 to 18 days after symptoms begin, 5 again being the median. So it is unfortunately difficult to detect PAM due to how rapidly it progresses. So it's usually diagnosed after death. And its symptoms are clinically similar to those of bacterial meningitis, which lowers the chances of it properly being diagnosed. And just overall, the outlook of people who get the disease is poor, although early diagnosis and new treatments might increase the chances of survival. And so the symptoms are usually seen in 2 different stages. And here they are. I would not like to have any of these symptoms. They seem horrible. But as you can see from stage 1, severe frontal headache, fever, nausea, vomiting, these are symptoms that we see with a lot of common diseases, or like the flu, or with anything that we see. I mean, severe frontal headache, it's hard to classify headaches because they're different in everyone. People have different pain tolerances, so what for me can be a level 9 headache, for someone else can be a 3. So it's hard to classify this, but these are symptoms that people have fever with sinus infections, and people are nauseous all the time, and people vomit with food poisoning, and so these are symptoms that we see all the time. So it's hard to classify it, and so then once we see these stage 2 symptoms, it's a lot harder to treat it. Once you see these symptoms here, it's hard to treat a coma, so really sad. So treatment of PAM. So due to the rarity of Naegleria fowleri infections in humans, there are no clinical trials to date that assess the efficacy of one treatment regimen over another. Perhaps the most agreed upon medication for the treatment of Naegleria fowleri infection is amphotericin B, which has been studied in vitro and also used in several case reports. Although amphotericin B has been the primary drug of choice for treating primary amebic meningoencephalitis, its use is associated with multiple side effects, including use-limiting renal toxicity. In 2013, 2 patients infected with Naegleria fowleri survived after being treated with maltifisone. While these results are limited, they show promise for the use of maltifisone when early diagnosis made. So, I included these 2 medications because they were the ones that I found the most information on when I did any kind of research on treatment for primary amebic meningoencephalitis, just because there is no standard. You have a fever, they usually tell you to take Tylenol, or acetaminophen, or they tell you to take some kind of ibuprofen, something like that. But with a disease that is so rare and so, there's still a lot that's not understood about it. There's not really a drug of choice. And because it's so rare, and because we don't see as many cases, which is good, it also doesn't help us find an adequate treatment option for it. So it's kind of one of those like, yeah, we don't really see that many cases from it, which is great. But since we don't see that many cases from it, we aren't really able to have that many, times that we're able to, have these like clinical trials. We're not being able to test any medications on actual patients that are suffering from this. So it's kind of hard to have an actual treatment, plan for a patient who has this. So I think it's kind of scary. So I kind of think about like if I was a patient in that situation, I'd be kind of freaked out if a doctor told me that I had this. So yeah. All right. So changes in treatment for PAM. So to date, there have been only 7 survivors worldwide, to whom 4 survivors were in North America, including 3 in the United States and 1 in Mexico. Due to it being a rare disease, adequate research on treatment is limited, but new medications are constantly being tested in hopes of increasing the survival rate. Again, like I mentioned, there's really not that many opportunities to test out these medications, but they are being tested out. And so hopefully one day we'll say, hey, this is the treatment that's gonna, help us increase this super, super small survival rate and make it hopefully grow and grow and grow because, this big red, chunk of this pie graph is scary. How has this disease been understood or viewed within society? Has this changed over time? Although PAM is rare, it has not stopped countries around the world from some form of action to protect its people. In 2007, the CDC advised Arizona residents to wear nose clips when swimming and diving in fresh water following the death of 6 people that year. And in 2013, Taiwan's Center of Disease Control recommended people avoid putting their heads underwater to prevent fresh water from entering their nostrils. So I included this sign right here because I found a lot of pictures on the internet that had these signs that said, do not allow water to enter your nose, Naegleria fowleri, and amoeba common to thermal pools may enter, causing a rare infection and death. I found a lot of these images on the internet, meaning that there are a lot of these signs out there in the world waiting for people to like probably ignore them and go swimming. But I think it's great that, these signs are out there warning people, although people probably don't listen. I think that people should avoid, swimming in places that are, fresh warm water, because you never know what's in that water. I personally, I don't know how to swim, so I don't swim in weird places that I don't know the depth of them. Depth. Sorry, I can't talk. It's kind of late right now, so I'm kind of sleepy. But I usually don't go swimming in any of these weird places, but like people that do know how to swim, that like to swim in these places, just don't go swimming. I mean, don't go swimming in these places. Go swimming somewhere that has chlorine, Um, and before I, move on to the next slide, chlorine does kill this amoeba. But, we can't just go on and inject chlorine or Lysol into our brains to kill it because that doesn't work. So, if you ever hear anybody telling you to inject Lysol or to ingest Lysol, don't do it. It doesn't work. It's going to kill you before it kills whatever's in your body. Or it's going to kill both of you. Or it's going to kill you before it kills that. All right, so how has this disease been understood or viewed within society? Has this changed over time? So it's unknown why some people become infected and others don't. So no one knows why some people that go swimming and get infected, and other people that go swimming in the same exact lake that could have possibly swam right next to that person that got infected don't get infected. Like, they don't ever show signs. They don't, ever get sick. We don't know why. So I just included this interesting graph provided again by the CDC. So it's a number of case reports of primary amoebic meningoencephalitis by month of illness onset and probable water exposure in the United States from 1962 to 2018. So it's pretty recent. We're in 2020. Yeah, we are. Sorry, I had to think about that. So it's, pretty up to date. So as you can see, green is the biggest one that we have here. So that's lake, ponds, and reservoirs. And as you can see, July and August and September are our biggest months with the biggest number of cases. So yeah, warmer months, more cases. We also show canals, ditches, and puddles, and rivers and streams also show pretty, significant cases. I also did read somewhere that stated that southern states usually will report more cases than northern states. I also read somewhere, or I watched an interesting YouTube video like years ago. This was unrelated to this class, unrelated to this project, but it was a video about sorry, this is like really it's not off topic, but if you want to stop watching this video, I'm basically done with this project. I'm done presenting. But if you want to hear about an interesting story about a brain-eating amoeba that caused a Disney water park to close down, you can keep watching this video. If not, I'm done with the project. Like, I'm done presenting. That's everything I had to present. But yeah, basically I think it was Florida. Yeah, it was Florida. It was Disney World. There was a water park that used to be open that was called, I don't know what it was, but it was like wood themed, not wood themed, but it was like woodland themed or something. But basically it was like a water park, and it was like a lake. Like, they used an actual lake to make it, I think. And a kid got a brain-eating and amoeba infection in his, and he got sick and he died. But I don't know if it was Naegleria fowleri. I don't remember, and I didn't go and find the video. It probably was, because I know there's another amoeba that's also referred to as a brain-eating amoeba that gets confused with Naegleria fowleri. But yeah, it caused the park to close down later on just because it got bad press. But it was an interesting YouTube video, and if you're interested in this, you should go watch it because it's pretty interesting, and it just leads you to a whole bunch of interesting YouTube videos about like stuff like that. So yeah, thank you for watching my video. Sorry it was so long.